Welcome in everyone. Welcome to another Tuesdays and Thursdays with Care Patrol. We're so glad to have you here. We have more people joining, and I'll continue to monitor the weight room as we get going. Thank you for joining us today for Tuesdays and Thursdays with Care Patrol. It is another glorious day today, although it's not sunny as it often is when we're together. Today it's rainy, but I know that my azalea plants and vegetables and herbs are happy to be seeing rain this week and all week. So I challenge you, instead of viewing rain as a negative, look at it as a positive for the things that it does for us. And so as we talk about that, we'll talk about dialectical behavior therapy later as we get going today. This is a topic for us that's sort of dear to me in many ways, and I'm happy to share it with you. As you all probably already know, Tuesdays and Thursdays with Care Patrol is brought to you by Care Patrol. We are a placement agency, meaning that if you should have friends or patients or clients who are in a crisis mode or a planning mode around what to do around long-term care for an aging loved one, we're the people to call. We're happy to talk them through what Medicare is and is not, what Medicaid does and does not, as well as share with them options and the cost of those options for care. And we do that all at no charge to them. We're paid by the providers in our network. This allows us to remain free to them, and hopefully will allow us to be a tool in your toolbox should you ever encounter this, without fear of thinking you're putting someone in harm's way because they'll see a huge fee from us. So we're happy to do this. One of the things that Care Patrol does with folks is educate and advocate. And so in the spirit of that, we love bringing these CEU hours to each of you, because that's really our love, is education. So let's get into housekeeping. It looks like many of us, or a lot of us, are here now. As you know, those of you who've been with us before, we're credentialed by the Alabama Board of Nursing as well as by the Alabama Boards of Social Work. So in order for you to get your certificates, whether you're a social worker or a nurse, you must participate in this live CEU. This is not a recorded CEU, it's a live CEU, but you must participate for at least 40 minutes. The way that we know that you do this is twofold. One, if you're trying to join after 12:20, we can't let you in. Now, if you fall off, we'll certainly let you in. And then if you pay attention about 40 minutes into the presentation, we'll give you a code word. It's also a password. That password unlocks the evaluation. The evaluation is necessary for you to complete in order to get your certification, your CEU. So please do the survey. I've typed it into the survey button, and Ms. Vaughn and others I know have not received certificates. I finally, thankfully, discovered the issue with this. It should not be an issue moving forward. But if you have not received a certificate for any training that you've done in the past, please email me at this email on the screen, sbarnes@carepatrol.com, and I will shoot that to you. Please email me, sbarnes@carepatrol.com, if you haven't received a certificate. But in order to receive today's certificate, you will need to go to SurveyMonkey after the presentation. I'm going to read the address for those of you that aren't able to see the screen. Again, I've typed the address into the chat room, and I hope you'll use the chat room to ask me questions or to share, anything with one another. In particular, I want to know this from y'all. Should we move to Mondays, Wednesdays in July, or Wednesdays, Fridays in July, or Mondays, Fridays in July? But we're definitely going to move from Tuesdays, Thursdays, and in that way give you all 4 opportunities per week, usually, to get CEUs either through me or through Jay Jones, who used to work with me and now works elsewhere, but provides CEUs also. So I just want to make sure that all of you have the opportunity to get what you need. the Survey Monkey link, and if you're not seeing it in the chat room, just scroll up. If you're not seeing it in the chat room, it is HTTPS. That means it's a secure server, HTTPS:// www.surveymonkey.com/r, lowercase r, / all uppercase, KHFF, V is in victory, B is in boy, Y. So one more time, the Survey Monkey evaluation website is https://www.surveymonkey.com/r/ all uppercase KHFF, V is in victory, B is in boy, Y. So that is the Survey Monkey evaluation link that you'll be going to after today. We'll be giving you the password. Please know that you have to have the password to enter the survey. We'll give the password about 40 minutes into today's presentation. So there are questions rolling up the chat room. I may have missed some, letting other folks in. And now that we're here, let's get started with our objectives for the day. So those of you who are new, we are discussing dialectical behavior therapy today in our hour together. And I thank you for being here with Tuesdays and Thursdays with Care Patrol. We're going to, as objective 1, explain what dialectical behavior therapy is, and also how it relates to cognitive behavioral therapy, which we have discussed some in the past, particularly when we discussed trauma. We're going to identify the 4 core skills of dialectical behavior therapy, and we're going to see which is the foundational skill. And it may be surprising, really, to some of you to see what the foundational skill of this peer-reviewed therapy is. And you know, this is something that has been used by countless individuals in their practices and by countless individuals to overcome whatever need they may have. And it is a data-driven and proven set. And we're going to describe the function and our goals of each of the 4 core skills that are part of dialectical behavior therapy. So those are our objectives. Please do, again, when you're doing the evaluation, make sure that you do relay whether or not we meet these objectives. That's sort of the goal of the whole teaching, is to meet the objectives. So we want to make sure we do that. Dialectical behavior therapy has a goal of becoming calm, quite frankly. Being calm when in the midst of stressful and negative situations and the impact that results from those. And the hope is that we learn to become calm and form wise behavior and wise reactions and actions, as opposed to being overwhelmed or overreactive, or probably more to the case with most folks would be someone who just hides, puts their head in the sand. So what we want to do is give people the counsel and the ability to get out of their destructive behavior. One person who you might think of, and I think of in this case, as being overreactive and not being calm at all would be Garfield. So he's screaming down the hall, "We're out of candy bars. Contact the proper authorities. Appoint a special committee. Call a psychic." John, his, roommate, says, "I think maybe you should cut down on the snacks, Garfield." And Garfield now, in a calm way, says, "We're being a bit overreactive, aren't we?" Which is a funny way to look at what we're talking about, which is not funny at all. In fact, what I would say here is that in using dialectical behavior therapy, we're trying to counteract the intense emotions that we feel. These are called, in certain disorders, people have what are called labial emotions, meaning that they are subject to frequent and sudden change. And I bring up this photograph or this image to make a point, really, which is that we in America do not recognize mental illness as a disease, I don't think, at least not socially. I notice in my neighborhood that you often see bows on the mailboxes, bows and ribbons, and it's typically because someone's made a donation to some nonprofit, or sometimes, sadly, it's that there's a silver bow or a pink bow or a blue bow for someone who has cancer, and the whole neighborhood rallies, it seems, and everyone in the neighborhood has a blue bow in celebration of a child who has cancer. But what's interesting to me is that we don't also view other diseases like mental disease in the same way. I know, for example, at the same time many years ago that there were bows for a child suffering cancer, there was another child in the same neighborhood who was a cutter. Do you know what that means? That means that they take whatever implement or object they can and they cut themselves. And the goal is to try and, I guess the goal is to feel pain or relieve pain through the feeling of pain. It's an ironic thing, but that child, when they were going through that, there were no bows for that child. And in fact, the opposite happened. That child, the family lost their contacts. The child's siblings lost their friends. It wasn't that there were bows, that there were backs turned. So there was no outpouring of emotion for someone suffering mental illness, even though it threatened to take that child's life. The only thing that really saved that child and that family was this dialectical behavior therapy. And I bring it up to say, we do not treat folks who have mental illness in the same way as we treat people who have cancer. And I think it's a problem in our country, and particularly because mental illness instances far outweigh instances of cancer. So that's my soapbox, and let's move on. There we go. So DBT is also used to treat spectrum mood disorders. And in fact, it was created for that. It was created to address borderline personality disorder, which I would liken in a sense to sort of a little bit like bipolar or schizophrenic, but not, is the only way I can describe it. I've known someone, in fact, that child I mentioned had borderline personality. And so some of those attributes, particularly around manipulation and truth telling and those things, were things that child had an issue with. And it is things like DBT that help that child recover. And it actually, studies show that not only has DBT been effective with borderline personality, it's been effective with schizophrenics and schizoaffective disorder. It's been helpful with people who suffered sexual abuse trauma early in life and people who have chemical dependency or dependency on other things like binge eating or gambling. So DBT has a wide range of effectiveness with those who are partaking in it and who are using it for their clients. And so what CBT does, and DBT was born of CBT. I know that's a confusing use of acronyms. So dialectical behavior therapy was born of cognitive behavior therapy, which is an older therapy. And CBT focuses on changing or challenging cognitive distortions. These are simply thoughts or beliefs or attitudes that we sort of come to the room with, so to speak. And it seeks to improve our emotional regulation and coping strategies. So a cognitive distortion might be, nobody likes me. And in cognitive behavior therapy, we would challenge that statement by saying, well, my mother likes me, and my wife likes me, and my dog likes me. So some people like me, so I must be like a bull. And then we work on the coping strategy of the next time that thought arises, we'd go from, no one likes me, to, well, wait a minute, I'm a likable guy, someone likes me. And so that's sort of the, in a very simplistic way, how cognitive behavior therapy looks to address our distortions and challenge those and substitute those reactions with actions that are appropriate to the situation. And it's, a response to these intense emotions that we discussed earlier, the labial emotions, the emotions that change. So learning how to understand and name these emotions, then we begin to recognize the feelings around them. And that is what relates to mindfulness, which is what we're going to get into here shortly as one of the tenets of dialectical behavior therapy. So what is dialectical? Excuse me, let me go back because I missed it something. So we want to change unwanted emotions by using opposite reactions. So we actively target finding the opposite of what we would normally do as a means of coping with what's happening, if that makes sense. And so here we are with dialectical behavior therapy. And if you're wondering where the name comes from, it comes from dialectical philosophy, which is simply a branch of philosophy. Dialectical simply means dialogue. And so in that branch of philosophy, unlike a didactic branch, which would be a teacher like me teaching, it's one-sided. A dialectical approach is two-sided, you and I having a conversation. And in this case, in the dialectical philosophical argument, one person holds one idea, the other person holds an opposing idea, but their goal is a synthesis of ideas. They're each seeking truth. Neither of them have an emotional attachment to their argument, so it is a calm argument, devoid of emotion. They're seeking truth, and they're able to then find a balance between them. This is really the process by which dialectical behavior therapy works. It is a conversation, in effect, a dialogue in the mind. Okay? And so what the DBT therapist does is they work with the client towards acceptance of what is and change-oriented strategies for what might be or what could be better. And then they balance those in such a way that they arrive at a truth that is a truism for that patient in each future instance or occurrence or reoccurrence of that incident. So that is the goal, and that is the sort of reason for the naming of dialectical behavior therapy. It's a dialogue. Let me see if I can. There we go. So DBT combines standard CBT techniques. So they're married to one another. They both have techniques for emotional regulation and reality testing. And reality testing is really older even than cognitive behavior therapy. It actually is, I'm sorry, I was letting people in the waiting room. So reality testing was a Freudian concept. So this is in the early days of psychoanalysis. And what again does psychoanalysis mean? Very simply, it means talk therapy. So dialectical means dialogue, psychoanalysis means talk therapy. Cognitive behavior therapy and dialectical behavior therapy are psychoanalysis, they're talk therapy. Freud introduced the concept of reality testing. So go back to my statement before, no one likes me. It was Freud that said, well, wait a minute, does your dog like you? Okay, so we're testing the reality of what our mind is saying or telling us with the reality of what the world is telling us. But then DBT takes those two tenets of CBT and adds to it the concepts of distress tolerance, acceptance, mindful awareness, and this is largely derived from contemplative, meditative practice. But let me be clear here. The mindful awareness that we seek in DBT is not Buddhist. It's not religious in any way. It's not metaphysical in any way. We are not seeking necessarily any spiritual outcome, although that is the result. Instead, it's a simple practice of meditation. And some of you who've been with me in the past have been through this. We've looked at meditation as a means of arriving at a relaxed state. And so as I thought we've done that in the past and we have a minute today, I thought we might do it today. And so each of you who are able, who are seated, place your feet flat on the floor and let your hands fall to your sides. You may place them in your lap. Some people find it comfortable to have their palms up. It doesn't matter. You can actually be seated, standing, or walking. But in whatever way you are, you want to be calm and have your mind at rest. And you want to focus on your breathing. This is called vipassana, or breath meditation. And as you breathe in, you'll want to notice the sensation of the air rushing into your body. And as you breathe out, you want to notice the sensation of the air leaving your body. And as you breathe in, you feel the air brushing against the tips of your nostrils. And the air goes down into your body. And as you breathe out through your nose, you feel the air come through your nasal passage and touch the tips of your nose. And when a thought arises, you let go of that thought and focus instead on your breath, feeling your breath moving into your nostril and out your nostril, feeling sensation of the air against your skin. Breath is life. Breathing normally, breathing calmly, feeling the air rush into your nose, chase the air in your body as deeply as you can, and then out, breathing normally. Feel the air when you breathe back in. Rush through your body, down your trachea, into your lungs, down to your diaphragm if you can feel it. You feel it touch each of those points as it leaves your body. And if you have a thought arise, focus again on your breath. Feel your breath rushing in your body and out of your body, breathing normally. We'll do this 5 more breaths. No matter what thought arises, do not chase it. Chase your breath down your nostril, down your trachea, into your lungs and out. Feel your breath brush your nostrils as it goes in your nasal passage, down your trachea and into your diaphragm, and feel it touch each point as it leaves. Any thoughts that arise, focus again on your breath, breathing in, breathing out. Focus on your breathing, breathing in, breathing out. Focus on your breathing, breathing in, breathing out. And if you followed me during that, you may find that you're in a calmer state than when you entered or when we began. Dialectical behavior therapy skills for emotion regulation are all centered in the acknowledgement and knowledge of those emotions through mindfulness meditation. And the skills for emotional regulation include identifying and labeling those. So when one is at peace and calm, one can identify those emotions. I'm feeling anger, I'm feeling frustration, I'm feeling cold. They can identify the obstacles to changing those emotions and reduce their vulnerability to the emotion mind. We have the logical mind and the emotional mind, and the synthesis is the wise mind or the mindful mind. We increase our positive emotional events and we begin to stack those up so that when we have future negative events, we have an armor from which to draw. And again, we take opposite action from what we normally would do. And so that is, how we come about applying these distress tolerance techniques, which we shall learn about now. So, but first, let me hit again on the differences in CBT and DBT. So whereas CBT, cognitive behavioral therapy, is used to treat anxiety and depression, dialectical behavior therapy is used in treating maybe more egregious mental illness, such as self-harm, suicidal ideation, things of that nature. Traumatic events are more the subjects of DBT than is cognitive behavior therapy. They're both psychosocial therapies. Again, that means simply talk therapy. And CBT says that this is a social problem and not a severe problem. We're simply trying to get over depression. Whereas DBT says this is a chronic mental health issue that's going to take years of treatment. And this is what we're focused on. So CBT is short-term, DBT is long-term. And then the objective is to make someone organize their thoughts in cognitive behavior therapy and help them rid themselves of those negative thoughts. Whereas DBT sort of focuses on the greater macro problem of the emotion behind those thoughts, okay, and try to help a healthy relationship to those emotions in order to, in a sense, curtail those thoughts. So DBT goes deeper, if that makes sense. So whereas CBT says your thoughts and behaviors influence your life, DBT tells you that you need to accept whoever you are, wherever you are, and move forward from here in the present moment, mindful and wise, and using your experiences and experiencing your experiences fully. So one is I think, a macro approach. So where did it come from? Dialectical behavior therapy was developed by Marcia M. Linehan. She is a now retired researcher at the University of Washington, and she developed this treatment in the late 80s, and she developed it specifically to treat borderline personality disorder or other chronically mentally ill folks. And its effectiveness is, beyond successful, really, in many areas, including depression, drug and alcohol, traumatic stress disorder, even traumatic brain injury, and then any other sort of mood disorders. So these are her two books. I've looked for the first one, which is Asserting Yourself, and it, I think, was published in the 90s. It's a $400 book, so won't be getting that. The other one, I think, is more accessible. It's her training skills, handouts, and worksheets, and I think you all might find that an interesting book to grab. And so I've got a photograph of it here. It's the second edition, and Marcia M. Linehan is the author. So that's the reason for showing those to you. And so she wanted to treat borderline personality disorder. She wanted to help people assess the sequencing of events in their minds when negative things happen to them so they could avoid the undesired. And so her first real core insight was to recognize that the person she had been studying who had suicidal ideation or suicidal tendencies had all been raised in invalidating environments. And by this, we simply mean that they probably grew up in an environment where there was probably mental illness. There was probably no sense of what is right, wrong, true, or false. And so they were invalidated as people. What they were feeling wasn't real. What they thought wasn't true. And so she said, well, what someone like that needs is just unconditional acceptance. Unconditional acceptance. And she was thinking about that, which was employed by not a researcher, but by a teacher at the time, a Buddhist monk named Thich Nhat Hanh, and he just passed away. You may know him. He was fairly prolific in terms of books he wrote and teachings he wrote. But her goal was that she needed to develop an alliance with a meditative practice in order to find this unconditional acceptance, which only seemed to be found with those who were in meditative practice. And then the other thing that she realized is that the folks that she was helping had to want help. And that's true of all of us in any clinical setting. But what's interesting to me is really, and what's important to note, is this notion that she felt we had to find for those specific patients, and it turns out for others down the road, we had to have unconditional acceptance. And that's really the 4 core skills of DBT. Mindfulness is the core skill in dialectical behavior therapy. I said you might be surprised to learn that. So mindfulness, being aware of the present moment without judgment, attaching no judgment, simply being aware of what is around you, that's mindfulness, and that's arrived at through meditation most easily. There's emotion regulation, and I always want to say emotional, but in the case in DBT, it's referred to as emotion regulation. And this is understanding our vulnerability to our emotions and how they cause us to react in almost programmed ways that come about in an unwanted emotion or unwanted result or unwanted word spoken. So if we can regulate this emotion through the practice of mindfulness, then we can arrive at what we hope to be interpersonal effectiveness. And again, what did I say about folks that have mental illness? They are not embraced by this society. There are no bows and ribbons for people whose lives are in danger because they have suicidal tendency. No, no, no. Those are reserved for folks with other illnesses, other diseases. One of those reasons, I believe, is that we know each other based on our reaction and interaction with one another. We only have that to go from unless we're super empathetic. And even if we are, we only have what people show us who they are to believe that's who they are. So someone with mental illness is showing us themselves, but it's not really who they are. It's through the mask of pain and suffering that we're seeing them, and we're placing a judgment on them through that mask. And this is why there's no bows and no ribbons. And this is why there's no interpersonal effectiveness. But if we can remove that mask, then we can arrive at getting our objectives met with other people. When we show ourselves, we can show a healed person or a person in the state of healing, a whole person whose words are chosen carefully, whose reactions are monitored carefully, whose whole persona is calm and peaceful. That is where we want to get to with interpersonal effectiveness. And all of that sort of comes down to this. And this, you know, to be true in your own life. Self-respect is the hallmark of the relationship. If you can be in a relationship and maintain self-respect, it is a healthy relationship. If you cannot, it is not. And then mindfulness is most effective. And meditation is most effective in the last core skill of dialectical behavior therapy, which is distress tolerance. And this is, yes, Artidra, these slides will be available. Distress tolerance is getting through crisis situations without making things worse. And this goes back to the mindfulness of meditation, of accepting things as they are and accepting things as they are, and living with it. That's distress tolerance. And that's one of the 4 core skills of DBT, along with mindfulness, emotion regulation, and interpersonal effectiveness. I'm sorry, I've hit the wrong button here. Here we go. So mindfulness is one of the core ideas behind all elements of DBT. And it is considered a foundation because it helps individuals accept and tolerate. Accept and tolerate whatever, whether it's an emotional response to a situation or the situation itself, it allows people to accept. That is the core of mindfulness. There's another famous master of meditation in the West, who's actually Western. His name is John Kabat-Zinn. And his little saying here, I think, is a wonderful way to view this. Mindfulness is a way of befriending ourselves and our experience. Befriending ourselves and our experience. How do I get this to stop doing that, I wonder? And so the concept of mindfulness and meditative exercises are not religious. Once again, it is not Buddhist. We are not seeking a religious hold. Instead, we are trying to find a hold within ourselves, a place within ourselves that is calm and at rest, where we can pay attention non-judgmentally to the present moment, about living in the moment and experiencing one's emotions in the moment, fully, calmly, and with perspective. This is dialectical behavior therapy: acceptance, distress tolerance, mindfulness. So you can also use mindfulness to make yourself aware of your senses to a greater degree. And what does this do? This means that we have distress tolerance. So if we have, the principle of radical acceptance, which is the hallmark of mindfulness and the hallmark of dialectical behavior therapy, is radical acceptance. And that's simply accepting what is as it is, without attachment, without judgment, without emotion. And this, I think, little graphic to the right here on the screen, if you're looking, sums it up much better than I could. Radical acceptance would be two different responses to today's rain. One is, it's raining. I don't like rain. I wish it wasn't raining. My day would be better if it wasn't raining. My day is ruined. Every day is like this. It's always like this. Why is it always rain when all I want is for it to be sunny? That's not radical acceptance. What's radical acceptance? It's raining. Yeah, it is raining. No judgment, no attachment, no sense of self involved. An essential part of learning acceptance is to grasp the idea of radical acceptance, which we have now been talking about. One should face situations without judgment. This is where we're going with this. Acceptance also incorporates mindfulness, as I've said, and emotional regulation, because if you're not placing judgment, you're not placing an emotional construct around the thing you're judging. Does that make sense? So one of the ways that we can help ourselves remember our emotional regulation skills in DBT is to use the acronym Please Master. And I love that because really we are the master of our own destiny, as their famous poem says. And so we are the master of what's said to ourselves. So please, master, help me regulate my emotions. So we're going to treat physical illness, and that's the P and L of please. Seeing a doctor when needed. Self-care. That's part of pleasing the master, is self-care, health-care. Eating, not eating too much, not eating too little, not binge eating, not having an emotional attachment to eating. Avoiding altering drugs, mood altering drugs. One of the things that one must do to be a Buddhist monk is to swear off of all mood altering substances because they get in the way of mindfulness. Sleep, we know that you have to get the proper amount of sleep, and that varies. It may be 6, it may be 8, it may be 4, it may be 12 hours, but whatever your necessary sleep is, that is part of please master sleep is the S, and E is the exercise. Get up to 20 minutes a day of exercise. I've been telling my mother, who's about to be 86, that you don't have to do 20 minutes at once. You can do 20 minutes throughout the course of the day. Just when you think about it, do 5 air squats. Do that throughout the day, just ever so often. You'll tally 20 minutes before you know it, and your thighs will let you know tomorrow that you have done this. And then act, master. This is what I like. Please master action. Master the way that I am able to do one thing at a time and be confident and in control of that and gain confidence and move to the next thing and keep focused. Remember, focus is part of what we're talking about with dialectical behavior therapy. So it has 5 specific states of change, which the therapist will review when doing DBT with the patient. And the first 2 really have probably already been met, which is pre-contemplation, which would be simply not knowing one has an issue, to contemplation, which is the realization that in fact something is wrong. We may not know what it is, but we're tired of living this way and we're going to seek a solution. And that is when we come to the therapist. And then we begin planning what it would look like if we were to change and what kind of change could we make happen. And we're trying to keep the patient from harm's way while we do this, okay? Remember, we're dealing with people with very significant ideas like suicidal tendency, for example. And then we want to get them to the state of action so that we've got a plan in place through meditative practice and other practices of DBT. We've got a plan in place, and now we've got to act. We've got to assault or confront that situation in a calm manner, in an unjudgmental way, in a radically accepting way, and then act. And then maintenance is simply taking this litany of tools and using them when the situation dictates in the future, and knowing what situation dictates what action. So that's part of the states of change that we want to see. But it's not really until the 3rd stage that the patient really takes action. And when they take action, it's the maintenance that then keeps them from committing suicide. So then they advance into the mindfulness techniques even further. So there are 6 mindfulness skills used in dialectical behavior therapy to bring the client closer to achieving the wise mind or the enlightened mind. The synthesis of the rational mind and the emotional mind is the wise mind in this instance. There are 3 what skills, which are observing what is around you. And again, we're doing this in a mindful way, describing what is around you. And we're doing this in a way that does not incorporate an emotion or a judgment. We're not manipulating. We're not trying to get to something because we're saying what we think someone wants to hear or what we think will help us get our way. But we're describing what in fact is, and we're participating in the solution. And then the how skills that we arrive at mindfulness are, we're first of all non-judgmental, and that may be the hardest. Well, it is the hardest of all, in my opinion. Then being one-minded, and so not having disparate, thoughts in our head causing chaos. And then being effective in what we do and how we do it, and knowing that we're focused on what we're doing, so we're going to be effective, we're going to be confident. So the wise mind is overlapping part of the intuitive balances of reasoning and emotion and bringing them into one mind so that the present thoughts and emotions are recognized and dealt with appropriately and fairly, and then actions arise naturally and spontaneously, which are right action. And this brings us to the CEU word. This is both the password and the question asked for the code word in the survey itself on SurveyMonkey. And the password to SurveyMonkey is mindfulness. So the password is mindfulness, and that's with a capital M INDFULNESS, and only the M is capital. So capital M, all lowercase, INDFULNESS, mindfulness. And note that full only has one L in that spelling, not two. Mindfulness. Mindfulness is the CEU code word for today. So we've practiced somewhat, and we've talked about radical acceptance, and now we want to get to distress tolerance. And it simply is radical acceptance. Distress tolerance is a natural development of DBT and mindfulness, and it just simply allows the patient the ability to accept their situation as it is without judgment. And so there's no need for them to approve of their situation. There's no need for them to lament their situation. It simply is the situation. And if someone could put in the link for Lee, or Lee and anyone else who's looking for the Survey Monkey link, just scroll up the chat room and you'll see it posted there. So if you're looking for the link, it has been posted in the chat room, just scroll up. So distress tolerance, DBT was really the first therapy to incorporate distress tolerance. No one else even really recognized it. In other therapies, like even CBT, the goal might be to, somehow get rid of what was hampering or upsetting or bothering someone. In DBT, we're not at all looking to get rid of. What we're doing is simply to say, hey, this is what it is. Let's, shoulder up, fuel up and go. This is what it is. This is what we're working with. This is what we got. So let's just endure and get on with it. And so that's really what distress tolerance comes down to. So the one way we can monitor and keep ourselves maintained with distress tolerance is to use the acronym ACCEPTS. ACCEPTS. So ACCEPTS would describe, first of all, activities. A, use positive activities that you enjoy. Contribute. B, I think there's nothing like this. For contribute, if you put yourself out in your community and give yourself to others, I promise you, you will get out of your head and out of your funk. Comparisons, and I ordinarily would not believe in comparisons when talking about folks who are distressed with a mental illness. But there is a reason to compare in dialectical behavior therapy. You compare your current self to your past self, and you take great pride in how far you've come, and you remind yourself of that when you're feeling low. And emotions, just try and provoke positive emotions in other people. That's my prayer every day, is may I have a positive interaction with someone. And here's the thing too, around self-care. If something, again, you're someone with a big lot on your plate if you are receiving dialectical behavior therapy. So being able to push those things away is part of self-care. It's not sticking our head in the sand necessarily. It's simply putting it on the back burner while we do something positive for ourselves in the meantime, like make ourselves laugh, or take a walk, or read a book, or whatever it might be. Or you can even force yourself to think about other things. That would be really more the line of cognitive behavior therapy. Or do something that has a sensational, tactile appeal, like take a hot shower. That will, and and we all know this, if we're having a bad day at work, when we come home and take a hot shower, or a cold shower, or a long shower, or some kind of shower, we know that we feel better already, and we change our present moment. So another way to monitor and maintain distress tolerance is to improve, is to imagine relaxing scenes. It's to find meaning and purpose in your actions with others or with yourself. It's prayer. And this, if you're not someone who has a religious faith, prayer can be meditation. It can be simply sitting quietly with oneself. It could be whatever you want it to be, quite frankly. So long as you indulge in it. Relaxation, it might simply be that. And it's just, again, focusing on this moment, the present moment. That's the hallmark of mindfulness, is being in the present moment, in the here, in the now, without judgment. And that may allow you to take a brief vacation, or you may take a brief vacation. You know, there's some new Netflix things coming out. You might need to spend a weekend binging. Just take a break. That's okay. And then at the end of that weekend, encourage yourself and cheer yourself and tell yourself, hey, you did a good thing and it's going to get better. So emotion regulation, one of the other parts of DBT, and I know this slide jumps. I had a little trouble putting it together in terms of keeping my thoughts organized because there's so much to it. But emotion regulation is simply reducing your vulnerability to the negative emotions and thought patterns that arise in your mind so that you can plan coping mechanisms to combat those same thoughts and emotions when they arise in the future. And that would help you to manage the extremes of any of those emotions when they arise, and replace those with the positive emotions that you see here: love, awe, inspiration, amusement, pride, hope, interest, serenity, gratitude, joy, and love. And speaking of serenity, there is a serenity prayer that also might relate to mindfulness. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. So you see, there's an Eastern thought of meditation, there's a Western psychoanalysis, and Western prayer that all lead back to radical acceptance of the here and the now, and what is and is not. So in emotion regulation, we want to learn how to understand and name the emotions that we're feeling, because you may not know this, but some people don't know what the emotion really is named that they're feeling. So we want to change the unwanted emotions by replacing them with the opposite. Remember, we're doing the opposite of what we would normally naturally do. And then to reduce that vulnerability to future emotions, as I said moments ago, we want to stockpile the positives so that we have a toolbox, an armor to shield us from the future. And that will help us manage our extreme conditions. The code word and the password is the same, Darla. The 3 interpersonal skills that we focused on in DBT include self-respect. We talked about this. You can have no healthy relationship if you do not have self-esteem and self-respect at the center of it. Other respect, equally true. You can have no healthy, functioning relationship unless you have respect for the other person or entity in it. And assertiveness. So you have to ask for what you want. So this is just basically balancing the needs of myself with your needs and what I want, and getting those needs met while not somehow infringing upon yours. So these are the things that we learn about with interpersonal effectiveness within DBT. Now, the components of DBT, should you go to a psychotherapist, would be 4 components. There's a skills training group, and you would be discussing all the things we've discussed here, but you would be doing it in a group setting. So it would be instances from one's life in a group setting. And if you've ever done any sort of group therapy or witnessed it, you know how powerful that is. There's also individual therapy, there's phone coaching, and there's consultation teams. So they may have various people who are brought in, like, for example, your primary care doctor may be brought in, but it could be a cross-functional team of folks who are helping you with your therapy. And that, folks, is our hour on dialectical behavior therapy. And it did jump around. I felt like it did. I apologize if I lost anyone anywhere. The CEU code word, once again, which is also the password, is mindfulness. That has a capital M and only 1 L in mindfulness. I've misspelled it here on the screen. The Survey Monkey is due today. I'd love to see it done by 6. That way I can get out the certificates tonight. You will get them. I have discovered why they haven't been going out. If you haven't gotten a certificate, the reason is that I was using the blind copy field to send them out. And my email program, which is Gmail, I've discovered, does not support that many emails in the blind copy field. Therefore, some number of you each month above that whatever their cap is, we're not giving these certificates. So I apologize, but that will not be a problem in the future. But if you're missing a certificate for which you've been a part, please email me, sbarnes@carepatrol.com. Now, the SurveyMonkey link, if anyone is still missing it, I'll read it one last time. It's https://www.surveymonkey.com/lowercase r/ all uppercase KHFF V is in victory, B is in boy, Y. So that's our SurveyMonkey tool. Please complete it by 6 today. You must complete an evaluation to receive a certificate. And if you haven't received a certificate, please email me. And as always, we would love and appreciate any referrals you might have for Care Patrol whenever you encounter anyone who is in a crisis mode or planning mode around aging care options. So we thank you for your time today. And please, if you will, answer my question in the chat box before you go, which is, would you rather see us do Mondays, Wednesdays, Fridays, or Mondays, Fridays in July and moving forward? I'm going to allow some time for that answer for y'all. And I'll tell you that in June, we're going to be Wednesday and Friday, Monday, Wednesday. I was thinking we're going to have like a lot of competing. Either is fine, either is fine. Thank y'all. Thank you for responding. I appreciate this so much. I always appreciate it when folks are Monday and Wednesday. It looks like it's sort of taking the day. Monday and Friday is a good one. Either is fine. I'm going to keep looking at this for a minute, y'all. I'll keep this going just because I find it interesting. But in June, we're going to do all ethics. So all ethics. So it will be Tuesdays and Thursdays still in June. Please tune in. And if anyone you know is missing an ethics certificate, a live certificate, please have them tune in June for one of our ethics presentations. Monday and Friday. I'm kind of thinking Monday and Friday, y'all, but I'm going to put this to the larger set of folks and see what the vote is. So thank y'all so much. I appreciate you being here today. As always, I appreciate what you do. I appreciate you I appreciate your referrals, and I appreciate you putting up with me. Thanks so much.